Thank you. Mara, would you like to introduce yourself, and then I'll introduce myself and jump in?
Hi, everyone. I'm Mara McGrath. I presently work at Lucille Packard Children's Hospital. And June and I have been working on this presentation, I think, for about 15 years. Maybe not quite that long, but it was a presentation we developed, and I think Juno will go into the history a little bit of it.
And I'm Juno Duenas, and I'm the Director of Support for Families and a Family Voices Council member, as well as a Family Voices Regional Field Coordinator. And as Mara said, we've been working on this training and this book for families and professionals for about 15 years. The handouts you should have received today, I'm going to review those, include the Healthcare Connections Addendum. It's materials that we updated. A Healthcare Connections handout, which has more materials that we'll be addressing. Healthcare Connections Manual, which includes updated pages for 51 through 55 and pages 56 through 62, and then also the PowerPoint presentation. The one thing we did not send to you is the Healthcare Connections Manual, because we are assuming most people have it, and if you don't, we can give you a link later on of where to get it. The whole presentation is based on how to use the Healthcare Connections Manual to help you serve families. Okay. All right, we tried before and I was able to move this, and now, there we go. This booklet was originally funded by the California State Council on Developmental Disabilities and was created by the Center for Access to Resources and Education, which is otherwise known as CARE, the Family Resources Network of Alameda County, Matrix, Parent Network in Marin, and Support for Families in San Francisco. And our agenda today includes looking at this booklet and thinking about core values, giving a description of healthcare services, knowing your healthcare plan, working in partnership with providers, advocacy, resources, and glossary. And again, we have sent on some adaptations, hence the additional handouts. We have reinvigorated this training because we know as family resource centers and professionals in the community, we all have these new pressures to address the changes in the law as quickly as possible. And our hope is by providing an overview of this tool, it will help you be effective in serving families. Having said that, we want to assure you neither Mara or I are insurance brokers or insurance experts. And although we have made recent changes, as soon as you write something down in a document, the next day it changes. So just take these changes with a grain of salt. Know that the world is constantly moving. Again, we still think it's worth it, even though the changes keep happening. We think this is worth it because this can be a helpful tool. All right. Core values regarding healthcare for the American Academy of Pediatrics includes how important family-centered care is, how important informed consumer choice is, that collaboration in caring for an individual with disabilities or special healthcare needs is critical, and collaborative both with parents, professionals, as well as youth. Sharing information, again, is an important core value, providing community-based services and cultural competencies. And the Academy wrote these up with the idea that if they set core values, then community-based organizations, healthcare systems, families would have a vision of how services could be provided.
So, if we were in a live classroom today, I would start asking you questions like, can you tell me what this alphabet soup actually means? One of the things that the Healthcare Connections Manual does is to describe these different types of health insurance plans, which becomes absolutely critical, especially now for those of you who are working in early intervention and prevention services. Now that families are having to access their insurance, families are having to really understand what kind of coverage they have, what all of these different letters mean. And so the Healthcare Connections Manual, starting on page 2 through 4, goes through HMOs, Health Maintenance Organization. The POS is purchase of service. Point of service. POS is purchase of service in regional center, but it's point of service plan within the insurance rubric. PPO is preferred provider option. EPO is exclusive provider organization. So you can obviously see, and it goes on and on. It includes IPA, which is independent practice associations, like maybe some of you might be familiar with, like Brown and Tolan. But anyway, all of these plans have different caveats. An example would be that the exclusive provider organization is sort of an open-ended health maintenance organization with increased patient cost sharing for out-of-network care. So those are all the little subtleties that families have to start learning about as they access their insurance. Next slide. These are a couple of additional type insurance plans, not covered as in-depthly as the previous ones. The self-insured health plans, they're more rare, and also the multiple employer welfare arrangements. But these are terms that if those of you out there are helping families with navigating health insurance, that you might need to become familiar with. Next slide. Okay. So these are the public programs. These two are also described in great detail. So on page, when you get to the Healthcare Connections Manual through the link that Tara will send out later, on page 5 to 6 there's a brand new chart. And actually the chart is it's 6 pages long, but it goes into the details not only about Medi-Cal, EPSDT, Healthy Families, Healthy Kids, AIM, which is infant and mothers, TRICARE, which is a military health coverage, Kaiser Cares for Kids. It talks about eligibility, where to apply, how long it takes for applications, what benefits are covered, what are residency and financial ceilings, limitations, and what legal papers and residency is necessary. This is just an excellent, excellent resource. The chart format makes it very accessible for anyone who's trying to figure out what the insurance is, what the public program is, and what it covers. Next slide.
Mara, they actually have a handout.
Oh, they do. I'm sorry.
That's right. That is.
Okay, I'll go to that then. My apologies. I have it right here. So as just for review, yeah, it's set up so that you do have the questions on the left margin, which is who is eligible, what are the income limits, what does it cost to be part of that program, what are your resource limits, which is like sometimes adjusted gross income, and immigration status, California residency, and documents required. And then it goes column by column through the programs, and also includes California Children's Services, Child Health and Disability Prevention. Now the programs that are listed on this slide are all under Children's Medical Services. And each one of these programs, even though they're under Children's Medical Services, they have different eligibility requirements, both in terms, some have financial eligibility requirements and some don't. For instance, the Genetically Handicapped Persons Program, you just have to be medically eligible for that program. You do not have to be financially eligible for that program. You have to meet the definition of the 12 genetic syndromes that are covered by that program. Let's see. Okay, next slide. Included in the chart are the description of other public programs which may not be perceived necessarily as healthcare service programs, but are really critical to the overall health of the individuals. And many of us are talking specifically about children 0 to 3 or 0 to 5. So the WIC and food stamp programs, nutrition is critical for kids to participate in a lot of the early intervention programs. SSI, IHSS come up both in the early years, but specifically when persons with disability turn 18, they can access, because their parents' income is no longer, it's set aside, it's no longer considered. There's information about regional center and the waivers, the different waivers. HCBS stands for Home and Community-Based Waiver. And then there's descriptions about mental health and access to things like AB 3632, which is accessed primarily through the schools. Next slide. So the nice thing is that this chart that has been provided to you as part of this training is updated every year. We cannot say enough about the Children's Health Access and Medi-Cal program. They are at that website. They not only will have the updated information, so if there's any changes to program eligibility, those will be reflected in the charts on an annual basis. They also upload the new federal income guidelines, which I should add have not changed this year. They've been flat for the first time that I can remember. They didn't change. Usually they kind of edge up a little bit every year, but they have been absolutely flat. There's been no change as of it. They usually change in April. But if the income guidelines change, those will be posted. And then there's other handouts available on this website. Just invaluable. Definitely make it a part of your favorites. Next slide. So in addition to actually understanding, explanation of coverage, explanation of benefits, it's really important that folks come up to speed, because so many people right now are going through unemployment and benefits and are having to COBRA their insurance, is to understand just kind of basically what COBRA and CalCOBRA are. COBRA typically extends health care benefits when someone is laid off for 18 months. CalCOBRA can extend that benefit for another 18 months, which makes a total of 3 years or 36 months. Really important things to understand. HIPAA is another protection for insurance, for the purposes of insurance and continuity of services. And another website that we're including in this presentation is the eHealth Insurance website, which makes you put in your information and it sort of calculates for you what would be a good plan given the income and needs and benefits required of the family. So next slide, Juno.
Okay, so originally this book, Healthcare Connections, was created to address the needs of families who are trying to identify a plan or provider. And things have changed a lot since 15 years ago. Now we don't have as many choices about where we might have our health care plan. And so today what we're focusing on is how to assist families to know what their plan is so they can better use it. So this section is broken up into, in order to know your health care plan, know what your family's needs are, know your health care plan, and know what to do if there is a problem. There's a handout that Tara sent out. It's called Know Your Health Care Plan, and basically I'm going to walk you through that. The first part of the document is broken out into therapies, home care planning, service, adaptive equipment, medications and supplies, and durable medical equipment. The truth is that your family may have additional needs, or a family might have additional needs. This is just to get the juices flowing. So this page can be used with the family to sit there and think, so what are their needs? And be able to articulate it, be ready to articulate it with their health care plan. Mara and I went against all PowerPoint methods, and I realized that this slide is very small, but it's just using it because we aren't in person and we can't show you the pages that we're talking about, so we're still hoping this way of doing it is helpful. Anyway, okay, so it's broken out, like I said, and families may have additional needs that we haven't articulated, and they should think about that before calling their health care plan. Next slide is Know Your Health Care Plan. When working with families, it's really critical to remind them about the 3 W's, who, what, and when. That's what they need to be able to write down. And I have to say, after years and years of looking at what families write down, they really do get confused about what information they should keep and what do they not need to keep. And if you can remind them about the 3 W's, who, what, and when, especially when they're dealing with a health care plan, it's really important that they track that information. So one of the next section, when they're talking about knowing their health care plan, I'm going to flip over this. There are things that will help them with waiting time, therapists that are not in the plan, what is the denial process, and again, this goes against all PowerPoint presentations, best practices, but in order to be able to communicate, we thought it was best just to copy and paste into the slide. Here are some important questions that are in the handout. Who can you talk to in the place of your employment? Families need to know that. Is there a case manager or care provider? Are there any caps? Are there co-payments? Is there a clinic in the plan that specializes in their child's diagnosis or disability? Are there classes or information for your child's diagnosis or disability? Are the therapists and specialists trained in pediatric care? This is something that's coming up all the time. And especially with the regional center changes, families are using their insurance company. These are questions they need to be able to ask. What if the provider has a long waiting list and your child needs to see someone right away? What is the plan's policy on the maximum time a patient must wait before they can see someone else? And what if there are no therapists or specialists in the county that are covered by the plan? I know. Best practices of PowerPoint out the window. Again, these are the questions. Is the plan open to adding your child's therapist? Are funds available for transportation? So I want to go back to that first one. A lot of families already have therapists that they're using but may not be covered by the plan. And some families have found by going back to the health plan and saying, can I add my child's therapist, that they're actually open to it because they don't have other therapists and there are other families that need that same service. Again, where do you go? I'm skipping down, but where do you go to get equipment and supplies? Does the plan cover costs for repairs? Who has to approve requests for equipment? How are prescription drugs covered, etc.? But the book and the handouts have a lot of helpful questions for families. Okay, moving right along. So know what to do if there is a problem. Depending on what kind of coverage a family has, we picked out 2 here. What they have to do if there is a problem is different. And again, this book helps outline what to do. So if you have a health management organization or if you have a preferred provider organization, you might do different things. One helpful tool is another handout we passed on to you is tips from the California Office of Patient Advocate. And they outline in the document, state your problem, and they help you to figure out how to do that. And how to track the date that the problem happened or date you became aware of it. Information regarding filing a complaint with the plan. What kind of information is important to have. And then it's really important for families to track the plan's response. And if the plan does not respond, they give you resources to go to, which is the Department of Managed Healthcare, HMO Help Center. Okay, and I've got, at the ends of these slides, I've got the more contact information for you guys on this. If there's a problem with a PPO, there's documentation you have about how to file a complaint with the plan, how to file a complaint with the state, and how to request an independent medical review. And here is the contact information. Again, these resources are awesome. Families need to know that they have the power that an appeal actually can get a denial overturned. Our challenge is that families are overwhelmed and don't know how to use the process, and so they don't follow through. But if we can get the information to them, they really do have the power. Again, here are those resources. The Office of Patient Advocate, OPA, really helps you with information about how to use your health plan. And then the second website is more about how to file a complaint. And then the Department of Managed Healthcare, Health and Information, has information about health plans, benefits and rights, again, problems and complaints.
So I just want to underscore a couple things that Juno just said. I believe some of you may have been on a previous brown bag seminar with Susan Berger and Lynn Gage around what the Department of Managed Healthcare does. And we cannot say enough and remind you that that appeals process, which starts independent medical review process, is I think it's been stated that 60% of people who start the appeals have a decision overturned in their favor. So it's not to be ruled out. Anybody who's on Medi-Cal managed care has access to the HMO helpline. So it's really something to keep in mind when using these resources. The other thing, most health plans and the providers on the plan is a moving target right now. With the changes to regional center, a lot of folks who are vendored to provide services, speech, occupational, physical therapy, once the requirement was that families had to access their insurance first, a number of those vendors have now turned around and are seeking paneling by different health insurers, whether it's the managed care entity, the local managed care entity, or one of the PPOs. A number of them are seeking paneling through those organizations. So you have to check, because some of the providers can follow the patient if they're on that new panel, and they are getting paneled pretty quickly. So the next section that starts on page 18 of the Healthcare Connections manual is working in partnership with your provider. And spending a lot of time working with pediatricians in Alameda County, I can't say enough about the importance of this section and sort of the shared responsibility and communication that goes on between the pediatric provider and the family. So there's lots of tools in this section that help with actually getting ready for an appointment by kind of getting yourself organized with questions and concerns, keeping track, of medications, what you're supposed to do between appointments. There's a telephone log. It's always critical that when somebody is told something, like if it's even a verbal authorization on the phone, if they document it, they document the person who said it, who they work for, what the time of day was. So all of these little, these inserts in the Healthcare Connections Manual assist the family in organizing the health care for their child. The key people chart is, again, the people you talk to, be it a pediatric provider, could be a specialist, could be a therapist, but a way to keep track of that. Many of you out there, if you're in family resource centers, have your own family notebooks that you use, your own child health records. Kaiser now is downloading records onto flash drives and making them available to families. So there's a lot of things that can augment working in partnership with your provider. So we wanted to spend a little time on the regional center insurance requirement, because this is kind of what has really, I think in many respects, resurrected everyone's interest in healthcare connections and accessing insurance, because families were having to do that at a much higher rate than previously. So in your packets that you received, it's actually, you have it in letter form, but I'm just going to really quickly walk you through something that we did locally to try to make it easier. So first of all, we very succinctly, and you're welcome to use any of this language you want, but we had to describe what the changes were for the providers in the community, because they weren't really understanding. I mean, they would hear from their families, but they weren't understanding the exact impact and what their role was going to be. So this is just, again, this is just in a one-page format in your handouts, but we're just looking. This is just a quick description, and this is taken right from the DDS PowerPoint that was done on the changes in the insurance requirement to describe the issue. Next slide. And then with actual recommendations about how the process should work to make it as seamless as possible for the families. So making sure that they identify a diagnostic code when referring to for evaluation and treatment. And we also were able to provide, and I want to just say that this letter that we're using was vetted across many, many agencies, including regional centers. So they have approved what we are disseminating to providers to help them with sort of make some sort of sense out of all this chaos around the insurance. So not only did we identify the diagnostic code, which is called the ICD-9 code, that would be useful, we listed a bunch of CPT codes, which are treatment codes for evaluation and therapeutic services. And then, well, you can read for yourselves. Next slide. So this is just a list of the example of CPT codes that our providers are using. The reason that we gave them the CPT codes is that a lot of pediatric providers hadn't previously had to do this. They just referred to regional center. Regional center did the evaluation, and then through either a home program or, in the old days, a center-based program, the families received these services. So they never had to really concern themselves about what CPT codes to use. So in listing these, we actually asked those providers in that area, vision providers, physical and occupational therapy providers, to identify the most common CPT or therapy codes that are used. Next slide. And the documentation of the process, we cannot underscore the importance when families are asking their insurance for authorization of services that they identify dates, because if the regional center is going to pick up any of those services, they have to know how long the authorization or how long the family has been seeking authorization, because many of the regional centers will begin or commence services because of their 45-day timeline. So it's really critical that there be some sort of paper trail that includes the dates of referral and if appeal has started or medical review has been requested. So this is, like I said, this is not like the end-all be-all, but it's where we've started, and the providers have found it very helpful to use this letter and these guidelines for helping their families access insurance and working in partnership with their families. Next slide.
Okay. So the next part of the book is called Advocacy. Starts on page 26 of the book. And there is a template for how programs are laid out and how the information is laid out regarding private insurance managed care plans, private insurance fee-for-service, Medi-Cal managed care, Medi-Cal fee-for-service, California Children's Services, and regional center services. The template is laid out so it talks about how to get services, what to do if there are disagreements, who to call, and tips on what to remember when you're doing this. And most important for those of us who are visual, they're maps, they're pictures. If this doesn't work, go there, and if that doesn't work, go there. And we showed the map of California Children's Services, of course, to the state to make sure that we had the right information. And the feedback we got was, oh, don't be ridiculous. It's not that complicated. Let us work on it for a few days. We'll get back to you. And about a week later, we got a message back saying, yeah, it actually is that complicated. So we tried to make it as simple as possible, but it just is the way the system is. The important thing is that when you're dealing with the family, again, they need to be really clear about what plan they have, because it makes a difference about who you go to. And sometimes the truth is they're not sure about what plan they have, and that's why they're having such a hard time. And then there also is a section on writing letters, which we don't have to show you, but it's a helpful way for families to be able to have a template. So if there's a problem, some of us have a really hard time figuring out what we're supposed to say. It's a template they can use to do that.
Okay, so resources. There's a whole section in your Healthcare Connections manual at the back that's on resources. We have updated that, and that is one of the handouts that you receive separate from the, so when you go to the Healthcare Connections link, they'll have the old one, but you've received the updated one, so you can just switch it out. So pages 51 through 62 have been updated. The resources have these really nice, again, templates for you to follow. There's a page that you can list all your local resources. You can list California Children's Services, Child Health, CHDP, Family Resource Center, the health plan, Healthy Families. You can not only put down the addresses and phone numbers, but you can identify your inside person, your contact person, your liaison, whatever you want, as a way to sort of fast track access to services and coverage. In addition, the resource section includes other public agencies. We've talked about them earlier. Access for Infants and Mothers, the AIM program, CCS, California Kids, CalWORKS, CHDP. The list goes on and on. It gives you the state number, the 800 number, but it gives you room to list any local numbers that you might need. Let's see if there's anything. It also includes advocacy numbers, the Developmental Disability Area Boards, the state councils, Family Voices, Disability Rights California, which is the old protection and advocacy folks. In the resource section, all of those are listed. And again, I can't underscore the importance of adding any local contacts or kind of inside folks that you go to as an easy reference. Next slide. Okay, glossary, same thing. The glossary for many, many folks, the things like least restrictive environment, LRE, FATE, all those things. It is absolute alphabet soup out there, and either for families or folks that are new to family resource centers, or for agency folks who aren't familiar with the lingo of, like, say you're in CCS and you don't know the regional center lingo, the glossary is invaluable for just looking up the acronym and finding out what it means, and sort of sorting out the whole alphabet soup. So that is available to you as part of your Healthcare Connections packet, or manual, rather. Next slide.
And this is where Healthcare Connections is available in English, Spanish, and Chinese. And the updates are only available in English at this point. And the next thing is questions. But before we go to questions, we are really interested in getting funds to update this manual if you think it has been helpful. So let us know. Let us know when Tara sends out the evaluations, let us know about the training, but let us know if this seems like a good document to use. That would be awesome. Thank you.
Questions?
Okay, guys, so if you have a question, go ahead and type it in now or raise your hand and we will unmute you. There was one early question from Julie. So Julie, I'm going to go ahead and unmute you so you can ask. Julie, are you there? Julie, you there?
My phone's on mute.
Hi, there you are. Hi.
Hi. So the question was, SDT is still a viable option. We had heard that it was being eliminated from the budget, but it didn't get eliminated.
Say the acronym again.
EPSDT.
Oh, EPSDT. There's nothing firm about that right now. No, it's still available.
So we're still
enhancement to Medi-Cal. So
yes.
That's early periodic screening, detection, and treatment, diagnosis and treatment, and
Right.
that was expanded. To those of you who are unfamiliar with that, that expands the benefits under Medi-Cal, often related to mental health services, behavioral services, and nursing, shift nursing. So at this point, we don't have anything definitive since we don't have a budget, and yeah. I mean, the state would forego a lot of money if they cut the EPSDT program because it's a federal match for that program.
Okay, thank you, Julie. We have a question from Patty. Well, she only wrote in part of it. So Patty, write in the rest of your question and then I'll read it out. We have a hand from Antonisha. Let's see. Can we hear you, Antonisha? Are you there? Antonisha, I don't think we can hear you, so why don't you go ahead and type in your question and we'll read it out. Okay. Now's the time to ask the questions about this guide and how to use it.
Or if anybody has any ideas about, other sections that need to be added, or, of course, all of that takes money, but
Not seeing anything yet.
I have a question for you guys. Has anybody been using this guide to help them? So nobody's using it?
do you know?
Yeah.
I don't know if, Janie, are you on the phone? Janie Tyre?
Janie. Janie is Janie Tyre. I can try to unmute. Janie, are you there? She may not be able to. Okay, I have a few type it.
Mention that one of the things that is coming up, I mean, I think that there might have, the Healthcare Connections Manual may have been somewhat dormant for a while, but I think it's a whole new ballgame with this insurance requirement, and I think it's going to have more of an application again because families do have to access their insurance and they do have to know the appeals process and how to ask about their benefits and knowing their plans. So I think, the history was that this was created when we were doing the big conversion to managed care. So it was so that families would know what they were signing up for. And now I think, and Juno makes this a point, is that they're already in plans. So now they don't have to figure out how to make their plans work for them. So I think there is going to be a resurgence in the need to use this document. And this was a conversation I was having with Janie. That's why I didn't know she was still on, and as she's working on the insurance issue at Region Center of the East Bay.
So Patty Moore says, our local ventured early intervention programs do not have paneled providers and do not access insurance, leaving families with limited services as consultant. are these, as consult, sorry, are these issues being addressed in other areas? It seems to leave early start with limited services. And yes, I use this guide and I love it.
Thank you, Patty.
Is that Patty Moore?
It is, yes.
What's happening is that we are losing a lot of early intervention providers because, and it differs, in different counties, but if they seek paneling through like the Medi-Cal managed care entities, the reimbursement is much, much lower than they were accustomed to getting as vendors. So there is a decreasing or a shrinking pool of providers right now because the Medi-Cal reimbursement for these services is significantly lower than they were accustomed to. I don't know if that answers the question, but it's a big challenge, and I think it's a big challenge in other areas.
I do think that I'm seeing more and more vendors, but obviously I'm in San Francisco, and that the regional center has also been hit with not being able to pay vendors whatever it wanted to pay before. The state is driving that truck about how much they can pay vendors. I would strongly encourage, that's something that family resource centers can do, is find out what vendors or therapists families are using that they're happy with, and encourage them to get those, let those therapists know to go to the insurance companies and sign up if they can.
Okay, we have some more comments too. Antonisha says, hi, this is Antonisha and Monica from Parents Can in Napa County. Our question is, until what age will Medi-Cal cover dental care? I'm not sure if you guys know that off the top of your heads or not.
It's either 19 or 21. I would have to look it up, but.
And I just want to reiterate, we are not insurance experts. Sorry. But I believe it's probably up to 18, but I wouldn't swear on it.
That's the one that they were trying to get rid of the dental as an optional benefit under Medi-Cal for adults. I thought they had preserved that benefit. I don't know if anyone out there knows for sure who has a young adult who's accessing Denti-Cal.
I'm not seeing any hands on that one, but Janie does say, I anticipate using this document a great deal to create the communication materials for families and trainings for regional center providers. And yeah, go ahead.
Sorry, but I just want to say that the regional center, we did this training for the regional center, and they really liked it. They found it really helpful.
And I have a question from Julie. Julie, I'm going to go ahead and unmute you. Hi, Julie, you there?
Yes, actually that hand was for using the manual, and I've used it for many years because it's been out a long time. The most recent one, I was glad to see that it was updated, mostly just for trying to understand, how each insurance works. But also, I wanted to say that recently I looked into the Denti-Cal for adults, and that was eliminated, but I was thinking 18 also, Juno. So,
yeah.
But somebody will have to look that up for sure. But I know that for adults, whatever they consider adults, it has been eliminated.
Okay.
Yeah, but they're I think what's confusing is they were talking about redoing it, but yeah, it's not covered now.
Oh, were they talking about bringing it back?
Well, because, everything,
Cobra.
there's a lot of talk right now about Medi-Cal and what should be covered and what shouldn't, and optional and all of that. So I think there's so many discussions it gets confusing about actually what is happening right at this moment.
Okay. Who could we write to? Anybody?
I actually just found a website, Elimination of Most Adult Dental Services Beneficiary. It's a PDF, so I can give this PDF to Tara, and she can include it.
Great. Does it have an age?
I'm reading very quickly.
Looking for numbers.
who are under 21 years of age with full scope Medi-Cal and are, okay, who can still receive adult dental services under Denti-Cal program is children or young adults who are under 21 years of age with full scope Medi-Cal and who are EPSDT eligible.
21.
So it says that it's been terminated for those over 21.
Okay, I lied. Thank you.
I will send this on to Tara.
Great.
Okay, great. I'll include that in the documents. Patty says, if we can't afford to bring you to our area, can we use your tools to attempt to present this to the regional center and families? Our regional center offers no assistance to families in accessing insurance.
Absolutely, absolutely, and you can have our notes too. So when we do the healthcare connections, we've got each page kind of written out in the notes section. So yeah, please use it.
But it's worth asking your regional center if they would help with that. I mean, if you want to do something. Don't rule out that they're scrambling at this point to figure out the insurance issue, so might be willing to pay the cost of a plane fare for a training.
Well, but Mara, I would think, Patty, if you can get them to pay, you take the money.
Yeah, absolutely. Patty's been through this training many, many times.
Well, and I think it's worth it to, for everybody to get informed and educated. And if you guys would like us to do this training and do it more of a trainers of trainers so that we can get it out there, that's fine too.
One question from Teresa. Has this training been done for San Mateo GGRC?
San Francisco. We did it for San Francisco, which is the same as San Mateo, I believe.
Yes. I mean, GGRC covers San Francisco.
But it doesn't mean they can't use it again.
Patty responds, yes, 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 I think, to your offer to do a trainer of trainers.
Mara can do it.
There's a follow-up. Which regional staff did you do it for at RCEB?
Oh, we haven't. We haven't. It was just under discussion with Janie, who's the insurance consultant. But I think it's a really good idea. So Juno's done it with GGRC. San Diego Regional Center folks were at a training down there. I believe, I guess it's the East LA folks are inviting Regional Center to a training on the 14th of October. So no, but in my own backyard, no. We haven't done that yet. It's a good idea.
And we also did it at the FERCE conference. FERCE?
Right.
Resource. And we could probably, I mean, if there was enough interest, we could possibly do it again and really work on the notes so that it's it's more of a trainer of trainers. So to hand that on to you guys.
Well, we should have a lot of updates once the state budget, and there's a lot of, and there's a couple things that go into effect with national healthcare reform this month. You know, the pre-existing and the extension to 26 years of age. So there's going to be some things that will definitely be updated as part of the healthcare connections.
Okay, great. And Patty notes, our regional center does not have insurance consultants, just as an FYI to other people. Not everybody seems to have them.
You know, it was funded by the first 5 folks in the East Bay. It wasn't a regional center. They didn't fund it. It was first 5 funding it.
Great. Well, I think that's all the questions we have now. If people are interested in doing a Train the Trainers, please just email us and let us know so we can get a sense. And with that, I will go ahead and thank you guys for the presentation. As a follow-up to today's call, you'll receive a survey by email. Please take the time to fill it out. I will, of course, send you a link to download all the materials from today's presentation. If you aren't on our listserv already, go ahead and sign up. That way you keep informed about upcoming presentations. If you have any questions, don't hesitate to contact us. And sign up for next month's webinar. It'll be on Wednesday, October 6th at 12. Understanding Service Delivery Models for Physical and Occupational Therapy, an overview of PT and OT service models used by California Children's Services and school districts, with Diane Storman from Exceptional Family Resource Center in San Diego. So thank you again to Juno and Mara.
Thank you.
Thank you.
Thanks, everyone. Goodbye.
Bye.
Bye.